Okay, I'm Brenda. I did mine on digital breast tomosynthesis. 1 out of 10 women will be diagnosed with breast cancer throughout their lifetime. Breast cancer is the most commonly diagnosed cancer in women. It is the second leading cause of death among women, and men can also get breast cancer as well. Mammograms have been the best modality with finding and diagnosing breast cancer. It's the only modality that has reduced the death rates of breast cancer. If the appearance on the mammogram is questionable, that is when a follow-up modality will be used, such as ultrasound or MRI. A biopsy is used to help determine whether it is cancer or not, or what stage the cancer is at. I have in the top right a picture of a ultrasound. The history of mammograms were discovered by a German surgeon named Dr. Albert Salman in 1913. He x-rayed a mastectomy samples and found that there was a difference between cancerous and normal tissues. He did have a problem, or found it difficult, because the tissues in the breast varied and the image quality was very poor. Also in 1930, a New York radiologist, Stafford Warren, began to take x-rays of women before mastectomy and realized that there were different patterns. In 1949, a major advancement happened when Raoul was born, discovered that by compressing the breast, it would pick up small areas of calcification and the beginning of a cancer growth. And by the 1950s, mammogram, x-ray imaging for healthy women became mainstream. Throughout the years, the technical modifications have been made, going from X-ray mammography to screen film mammography, full field digital mammography, which is 2D, and the latest development of digital breast tomosynthesis, which is a 3D mammogram. The top picture is that looks blue, is the X-ray mammogram. The one to the right is the comparison of digital and film, and then the bottom left is from the digital is on the left, and then it's the digital breast tomosynthesis on the right. Digital breast tomosynthesis is a new technology that is said to be helpful in the future, and it will help with reducing/eliminating tissue overlap. It is a modification of digital mammography unit to enable the acquisition of three-dimensional volume of thin section data. The images are then reconstructed by using algorithms. Direct digital mammography, or full field mammography, has improved throughout the years, especially with dense breast tissue, and the number of false positives is still high, though this is because of the presence of dense breast tissues that may affect lesions that are easily seen. High breast density means there is a greater amount of breast and connective tissue compared to fat. Low breast density means there is a greater amount of fat compared to breast and connective tissue. Starting from the far left, the first picture is considered a dense breast, the second is considered a fatty breast, the third picture is considered some breast density, and the last picture is considered more breast density. And to fix this problem does exist, and it's an MRI, but it is not a radical solution because it's expensive, time-consuming, and it's not available in some departments. Breast imaging should be affordable, fast, simple, and practical. In 1930, Alessandro Valbona, I have no idea how to say his name, created the stratigraphy, which later became known as tomography. Tomography is a well-known technique that uses motion to better exhibit relevant anatomy while allowing superimposed structures to fade. With this new technique, and thanks to flat panel technology, a reinterpretation in digital key of Valbona's tomography has been proposed as a new tool for early detection, digital breast tomosynthesis. And then in screen film mammography, the x-rays come from a stationary tube, then are absorbed by a phosphorus screen, which then emit light and will then expose the film. And then in digital breast tomosynthesis, the x-ray is a moving source and digital detectors are used. This allows volumetric reconstruction of the breast with a limited number of low-dose two-dimensional projections made by different x-ray angles. In a regular mammogram, the breast will be pulled away from the body, compressed and held between two glass plates to ensure that the whole breast is viewed. It will usually take 2 x-rays of each breast, top to bottom and side to side. The images will be created onto a film, or in digital mammography, they'll be onto a computer. And as you can see, it looks very uncomfortable if you have to get one. And then in digital breast tomosynthesis, the X-ray is a moving source and digital detectors are used. During the X-ray, of the breast, the X-ray machine will be moving along, creating an arc during the exposure. The exam will produce 10 to 15 images during about a 7-second examination, and the images are taken at different angles ranging from a -7.5 to a +7.5. In theory, the motion of the tube could be linear, circular, or elliptic, but most of the time an arc-like linear motion is best for the breast because most normal anatomic structures of the breast are oriented from the chest wall to the nipple. But keep in mind that other patterns might work depending on where the lesions are, and the number of images and the range of angles may vary. The wider the angle range it is, allows a thinner reconstructive section thickness of the in-focus plane, and this then causes the object in different planes to be less blurred on image acquired at a smaller angle. The information will then be sent to a computer where it is then reconstructed using algorithms. There are limitations with digital mammograms. The compression of the breast is an uncomfortable feeling. Because of this feeling, it could steer women away from getting tested. The compression of the breast can cause overlapping of the breast tissues, and this can cause breast cancer to be hidden. In a normal mammogram, it only takes one picture across the entire breast in 2 directions. With digital breast tomosynthesis, they are trying to overcome these 3 major issues. The breast is still compressed the same, but just enough so that the breast is stable, and it will take about 10 to 15 images, and it will be sent to a computer to be reconstructed. There are advantages and disadvantages of breast tomosynthesis. The disadvantages are when the images are produced, the files are much larger and will take up more space. Workstations are not suitable for digital breast tomosynthesis and require replacement, which would cost a lot of money, and special training would have to be required for staff. The advantages of digital breast tomosynthesis is there's an earlier detection of small breast cancer, the greater accuracy in pinpoint, size, shape, and location of abnormalities. There are fewer unnecessary biopsies or additional tests, a greater likelihood of detecting multiple breast tumors, clearer images of dense breast tissues, less image noise, fewer artifacts, and consistent quality in digital processing. I have some pictures comparing a 2D image to a 3D image, and as you can see, when it's reconstructed using a computer, you can see the mass or lesions a lot better. One cannot avoid getting breast cancer no matter what new technology has come out. With the advancement in technology, one could catch the breast cancer early and have a better chance of complete cure or longer survival time. With digital breast tomosynthesis, it helps with better differentiate, I can't say that word, between the overlapping tissues and can create a clearer picture. It causes less false positives and a lower recall rate. Granted, it has its disadvantages, but in the long run, digital breast tomosynthesis will help radiologists and doctors find the cancer faster. Any questions, or did everyone answer them?